great.
This is great.
Okay, guys. Welcome everyone. So I'll just try to briefly understand, give you sort of introduction what's like a dentistry, because people most of the time think dentistry is just being a dental surgeon. However, you can be a dental hygienist or therapist in the UK as well. So I'll try to give this because most of the people knows like what dentists do, sort of stuff. You must have been in a dental chair for many times. And then, so what sort of educational background do you need in the UK? So basically, overview of the dentistry, I think, is a very a chilling, very good job, especially in the UK. So it's not the same in other countries. It can be a bit more challenging, or just too much stuff. In Turkey, for example, it's just not as good as it used to be. And then, but to practice as a dentist, you need to have sort of some sort of skills. First of all, like a communication skills. You need to communicate with different people very easily, and try to manage people around you. And you will see different people, different backgrounds, and different kind of expectations as well. So you need to manage all of them. So it's quite not like your handful, the it's not about what you're doing in a dental chair. It's like how you sell it to the people. So that's a bit more important. But obviously, you need to have some sort of manual dexterity, which means you'll just need to a bit good dentist. You just need to do the stuff in a coordinated way. And then let me just check. And yeah, daily responsibilities, not really specific. We will be doing some sort of checkups, fillings, or endodontic treatments, or I'm working as a dental hygienist right now, and I'm most of the time doing dental hygiene, so which is cleaning the teeth, but I'm graduate as a dentist in Turkey. But it's kind of different sort of roles in the dental surgery. So some people do implants. So if you become a dentist, you're not going to do implant all the time. Or if you are an endodontist, you're not doing the other sort of a periodontal cleaning stuff. If you don't, I mean, it depends on the practice, a model. And also you have some sort of non-clinical duties. So you need to write a good report for after all the patients. So you need to write everything that's happening in the dental surgery. And referrals, yeah, you need to just refer people if they need to be referred. So especially if they have some sort of a serious situations like a cancer, like oral cancer is very common in the UK. Yeah, and so basically rewards, obviously when you see say dentistry, people say, oh, you're earning very well. Yeah, it's that's very true. I think we're earning quite well, above than average than other most of the jobs. So it's for being a dentist, so you learn around 80K per year at least, and then you being hygiene is a 60K at least. And then obviously it's just not one a positive aspect of the dentistry. You will be helping people, which will make a huge difference in long term, because you're learning some money, and then you start to think about why are you doing this, and you will start to think oh, I'm helping people, and it makes you feel much better, nicer. And then especially with elder people, they will show their. So I have I'm working a small town in here, and we have lots of care homes around here. So I see lots of old patients, and honestly, being with them is such a nice a relief for me, because they want to speak. They see you just to speak. Actually, they're not having big sort of treatments. But yeah, it's I think something to take into account when you're thinking about dentistry. And then work schedule, you can just adjust your days. Basically, you can just say, I'll be working this day, these days. So you don't have to work 5 days a week, 40 hours. So for me, for example, I'm off on Wednesday, so I'm having just sort of a gap in the middle of the week. It's just my schedule basically. And then yeah, you will be going for lots of dental conferences, dental programs. So it's quite variety of things you can do outside of clinics, so which is good. So I left this dentistry show London in October in Excel London, just purely because you can come in and just check what's going on. And I think it's a good way to understand what a dentistry is as well, because it's not just what you see as a patient, but it's also what dentists do when they are together. It's just because lots of the things are just an industry. You will see sort of like equipments or like brands, they're selling this stuff. It's most of the time you'll see like toothpaste brands like a Colgate, Sensodyne, sort of stuff. But you'll see also like small startups, which will be interesting to see. And then obviously there are some challenges in dentistry, which is quite obvious. Complaints are a very main one. So you need to like manage people as well because they will come in with different kind of feelings. They might have a bad day and they want to just like be rude to you. And then you just need to be patient and you just need to like understand what they're expecting from you from that day. And then that's the reason. And it's not just about you. So in a dental surgery I'm working right now, I'm pretty lucky because people are really, really like a kind. But it used to be I used to be in a different practice in London. It may not be that easy going people. And then yeah, days are really busy. So you will have a schedule, you will have lots of patients, and you don't have a like a chance to be late. So you need to be on the time. And then obviously if people don't like waiting. So I had a German patient. I kept him waiting for like a 5 minutes. He was really mad. So it's just sometimes you just need to be quick basically. And then yeah, you will be doing the same stuff sometimes, and then it can be a bit boring. So you need to like dentistry is more like a communicating with people. It's not like doing the stuff. So for checkup, especially, people will be coming in a year time, for example, and you will see same stuff. It's not too much stuff like changed. But the main idea is like just managing people and then speaking with them what they want to see you, or they just want to say hi, honestly. And then I will go through the NHS dentistry later on and then managing whole team as well. So because you're not working alone, so you will have nurses, receptionists, other dentists. And we have like, for example, we have a team of like 15 people in the surgery or like 20 people. And I have pretty much good communication with all of them, but sometimes it's not be the case for all of the people because you will see like some people and some different kind of ideas. You don't want to just say, "Oh, it's just not for me," and you cannot just say, "Oh, I'm going for it." You need to be in the team, and you need to like make people happy in the team as well. So it's very like what you do outside of the dental chair, basically. Okay, and so to become dentist, okay, so DDS means like a doctor of dental surgery. It's like being a dentist literally. And there's 14 undergrad dental schools in the UK, and these are the universities basically. You can just check the British Dental Association website for more information. And for dental and hygiene therapy. So I'm quite like my aim is today is to just to introduce hygiene and therapy for many people because there are more opportunities in hygiene and therapy, and you will be a practitioner, so you will be seeing people and you will be doing many stuff on your own as well. And it's like a not it's okay, it's not like dentistry, it's not like a dental surgery, a dental surgeon, but you'll be still doing many stuff, many like clinical like a fillings or like a hygiene checkups, and you don't have to have like A plus A stars, lots of A star. I'll go through it later. But yeah, we have 20 universities in the UK, so it's pretty much actually. And yeah, for educational background, you need to have A stars and UCAT exam. You need to go for it. This I think it's just last year, or like a year before, was like a requirement for the top three dental universities in the UK. So you need to have like A star at least from biology or chemistry, and then another two A's from like a physics, maybe math, psychology. And UCAT exam, you may need to go to UCAT exam. You may need to get like a higher GCSEs. I'm not going to too deep like details because each university has kind of different requirements from the applications. And for hygiene, dental hygiene therapy, so you don't have to like get like A stars, and you can have some A, BBs or like a triple B is even fine to get like hygiene therapy. It's just still like a very competitive area, but you don't need to have the highest rankings. There's a very important, I think, for people who want love to be like dentists, but who cannot really get the A stars. And then, yeah, you can also just check where is that? BSDHT, so it's British Society of Dental and Dental Hygiene and Therapy website. So they will give you some sort of like idea what they are expecting from you, basically. And so yeah, so typical career path in dentistry. So you'll be studying for 5 years for dentist student, like, so you will be a dentist student for 5 years, and then you'll become a dentist. It's very simple. And then after dentistry, you become a dentist. You can go either for specialty training, which I will show you in a second, and then you can go to academia, which is really fun. I did some like a master's degree, and then I love it, but academia is not for everyone. Can be a bit just too like too much writing, too much reading. And if you like writing, then it might be a good option for you. But you can try with just master's degree. You can do like a 1 year program, and then you can see yourself if you are fit for it. Then you can go for it. And dental clinic owner. So most people think, they ask me, they say, Burhani, are you going to open a dental clinic? Yes, I would love to, but it's not like a case you can do just tomorrow. It's just you need to save some money for it, and you need to like dental clinic management is quite big like a issue. So it's a big like a job basically. It's like not just being a dentist, but it's also managing some sort of like a place like a 15 maybe like 20 people are working. So it's really like a tiring stuff. So will I open a dental clinic? I don't know. I'm not really expecting anytime soon. So it's just one thing I just want to mention. So specialty program. So after 5 years of education, you can go for like a specialty program, and we have like a 13 programs in here. And then you will see some postgrad universities. I'd not give too much detail. I don't want to like keep you in a bombing you with the like lots of details. And then, but do you have to go for it? No, it's just if you want to, if you're enthusiastic about something. So I did like a master's degree on dental public health, and it was fun. I love it. It was at UCL, and I had really good networks. It's sometimes you just need to check. You need to just try, and you want to see yourself. And then if you think you will be a good academic, so that will be a good idea. But you don't have to. For example, if you want to do Invisalign, so you see like a like clear braces stuff. If you want to do Invisalign, you don't have to go for a specialty program. So you don't. If you want to go for like a so. You can go for extra courses like implant courses, composite bonding courses. Composite bonding is just like putting white composite on the front teeth and making your teeth whiter. And or endo course. Endo course is like a root canal treatment courses. And these courses are not like specialty program. You will be paying for it. I mean, it might be for like a year length program, but it's not like academic one. So these 13s are like academic. And then okay, let me just take. Yeah, so to become an NHS, so NHS dentistry is quite different than mixed private dentistry. Uh, I will not give you too much details because I have a short time here. I have 7 minutes left, and yeah, so become a dental dentist at NHS. After being a dentist, you need to apply for vocational training to become so, and you will get your after it's like a 1 year program, and you'll get your like a performance number. And during this program you will be seeing like a different kind of people, and it will be after your like your graduation from dental school. And there will be like a mentorship program, so someone will be like observing you, and someone will be checking you, and you will do some like a study day once a day in a like a big hospital maybe. uh, I'm not 100% sure for the like a detail because I'm not doing weekly theater. Okay, and then so what's the recommendations for the students? So to be honest, if you're like up to for it, please just search for like all the like opportunities around you, like observership. You can just email to like a dental surgeries and ask, can I just see like a staff for 1 day? And they will be happy to do that. And then you can do some volunteering at dental charities. I give some dental charity's name. But if you just Google for dentist, you will see like a dental mavericks, I don't know, dentate or like a bridge to aid. So these are like a kind of there are lots of dental charities around. And please open go for the open days. It will help you to understand as well. And then so continuing education. So we do like a CPD. So I don't know what was the CP stand for, but it was just like a short education. So like an hour training maybe. And it's mandatory for dentists for like 20 hours per like a year. And then for that hygiene therapist, just a 15 hours. It's not too much. It's just like education, like medical emergency training, for example. And an optional training, you can go for like to be honest, the dentistry, you will see lots of stuff like in dentistry, and you can as I mentioned, like Invisalign course, for example, like endo courses, composite bonding courses, Botox course, even hypnosis course is like available in dentistry, and we do use it during the day. Like it depends if you patients are happy to have some hypnosis, for example. And future opportunities, yeah, these are the two like news I just searched yesterday. So, for example, regrowth of the like regenerative dentistry. So they will put like some sort of cell in your bone, and it will create some another like a tooth. It sounds very like creepy, but it will happen hopefully by 2013. It's very like common, and then hopefully there will be some more like development around this way. And then AI in dentistry, so there are some robots going on. They will do your like a teeth. I don't know if people will be happy to have it, but yeah, it's something dentistry it will develop quite soon. Much more, it will be more interesting. And yeah, last advice is what do I advise? Please try to get like a so ask for like some people. So you can search from LinkedIn and just try to see some like search some people from the first year of like a dentist student like education, and then you can just ask what are the challenges they like faced, or like you can just search for like dental magazines. You can good if you just search for dentistry.co.uk. It's a really good website, and they will have sort of like lots of like information about dentistry, and you will see dental news, so it will be give you some sort of advice. And then yeah, it's pretty all actually. And give me a second.
Well, Nabi, thank you very much.
No worries.
Yeah, we still have 3 minutes. Maybe just to ask some questions. After in university, do you have any physical experience in clinics, or do you just learn the theory of dentistry?
Yeah. So first 2 years is just theoretical, but last 3 years for my so Istanbul University basically it's just mixed practice and theory dentistry. But
Mhm.
last year is mostly like 90% just practicing.
I see. Yeah. No, okay. So, I mean, straight after university, you can start working
Yeah,
as
yeah,
a
yeah, yeah.
dentist. I see. Okay. Great stuff.
Any
Uh,
question? Yeah, I'm very
yeah. So,
happy.
what we'll do with questions, they will ask me, and or everyone will ask their own area representative or mentor wise, and we'll get the questions across to you. I mean, thank you very much. You've prepared the presentation for us, and I think it's been very informative. And if there are any questions, we'll ask you, and if you could answer them, we'll appreciate it as well. So, thank you for volunteering on your Sunday morning, and thank you.